Hi guys, today's lecture about parasympathetic ganglia, or you can say these are the parasympathetic supply of the head and neck. So these parasympathetic ganglia are comes under column that is called GBE column, means general visceral efferent column. So now if you focus this GBE column, you can come to know this ganglia and how they are supplying the parasympathetic supply to various head and neck glands. So this is the midbrain, this is the pons, and this is the medulla. Midbrain, pons, and medulla. In midbrain, one nucleus is present for the head and neck parasympathetic ganglia, that is called Edinger-Westphal nucleus. This is Edinger-Westphal nucleus. Another nucleus is the pons, is the one huge nucleus, that is superior salivatory nucleus. Superior salivatory nucleus. Upper part of this nucleus is lacrimal nucleus. In this motor medulla part, there is one nucleus, that is dorsal nucleus of vagus. This is dorsal nucleus of vagus. Dorsal nucleus of vagus. This is dorsal nucleus of vagus. So these three nucleus and another for glossopharyngeal, that is lower pons. It is the inferior salivatory nucleus. So these four nucleus are main parasympathetic supply of the head and neck, which supply various lacrimal gland, submandibular gland, and the sublingual glands. So these four, this Edinger-Westphal nucleus is related to the third nerve. This superior salivatory nucleus related to the seventh nerve. This inferior salivatory nucleus related to ninth nerve, and this dorsal nucleus of vagus is related to the 10th nerve. So if you see what are the parasympathetic cranial nerves, so parasympathetic cranial nerves are 3, 7, 9, and 10. It means whatever parasympathetic supply to the head and neck is coming from these third, 7th, 9th, and 10th cranial nerves. So how they supply the various glands in the head and neck. Now I will tell you the codes. First nucleus is Edinger-Westphal nucleus. Through third nerve, it's going into the superior orbital fissure. Here in orbit, it's going oculomotor nerve. One ganglia is situated in this orbit is the ciliary ganglia, which is situated on the nasociliary nerve of the V1. Ophthalmic having nasociliary branch, frontal and lacrimal branches. So this V1 nasociliary branch having one ganglia, that is called ciliary ganglia. But this ganglia is not related with the ciliary nerve. This ganglia is related with the this oculomotor nerve fiber. These supply this ganglia by the preganglionic supply, and postganglionic fiber from this ciliary ganglia going through short ciliary nerve which supply the two nerves. These are the postganglionic fiber, postganglionic parasympathetic fiber which supply the sphincter pupillae and ciliary muscle. Ciliary muscle. What sphincter pupillae do? It constrict the pupil, and ciliary muscles which accommodate the lens diameter. So this is the ciliary ganglion, which is supply coming efferent supply or motor supply coming from the oculomotor nerve, and this supply is the ciliary ganglia. Now question, where is ciliary ganglia situated? It's lateral to the optic nerve, topographically related to the mesociliary nerve branch of V1, and functionally related to the oculomotor nerve. Now come this second nerve is the seventh, that is related to superior salivatory nucleus. This superior salivatory nucleus supply going through nervus intermedius, part of the facial nerve, and this nervus intermedius goes along with the motor fiber of the facial nerve into the internal auditory canal and goes up to the greater this geniculate ganglia, first genu, this is first genu, this is second genu, and comes out as a stylomastoid foramen. So this facial nerve geniculate ganglia having greater petrosal nerve, and this stylomastoid part having chorda tympani. So this greater superficial petrosal nerve and this chorda tympani are having parasympathetic component. So these main supply of superior salivatory nucleus going to going through nervus intermedius part of the facial nerve, ultimately going into the geniculate ganglia, through which one supply going into the greater superficial petrosal nerve, one supply going through chorda tympani. This greater superficial petrosal nerve goes along the floor of the middle cranial fossa, comes out through median canal. After crossing this median canal, it goes into pterygopalatine fossa. Here it's having one ganglia, that is called pterygopalatine ganglia. This ganglia is supplying the lacrimal gland, which is situated on the lateral wall of the eye. And this lacrimal gland supply coming through this parasympathetic part of this greater superficial petrosal through zygomatico-temporal nerve. This zygomatico-temporal nerve ultimately merge with the lacrimal nerve. Lacrimal nerve is the part of the, now I will tell you, this lacrimal nerve is the, this is the orbit. These are the lacrimal gland in the lateral part of the orbit. And this nerve, lacrimal nerve, is part of the V1 lacrimal nerve. And this is the pterygopalatine ganglia. This ganglia having some fiber going through this zygomatico-temporal nerve, and which connect this nerve with the lacrimal nerve. And this lacrimal nerve is topographically supplying the lacrimal gland, but main supply coming through postganglionic fiber of, this is the ganglia. After that fiber are postganglionic fiber of the pterygopalatine ganglia, which supplying the lacrimal gland through preganglionic fiber of greater superficial petrosal nerve. This greater superficial petrosal nerve merge with the another nerve, that is deep petrosal nerve, merges with the greater superficial petrosal forming the median nerve that ultimately supply the other part of the lacrimal, nasal and palatal gland with this deep petrosal nerve. So parasympathetic supply coming through greater superficial petrosal nerve, lacrimal glands. Now another root of this coming from this is stylomastoid foramen and this is chorda tympani. This chorda tympani comes out by the petrotympanic fissure, or you can say posterior canal of Hughes into ITF in infratemporal fossa, where it merges with the lingual nerve. So this lingual nerve is the branch of the posterior division of the trigeminal nerve. And here one ganglia in the floor of the mouth is called submandibular ganglia. So these fiber of superior salivatory nucleus coming through this chorda tympani into the submandibular ganglia, which supply the submandibular or sublingual glands. So these supply is important. Now this submandibular ganglia, if you having a hypersalivation, you can cut this part or you can remove submandibular gland and cut this part. So you are blocking the supply of the submandibular and sublingual gland. It means you are treating the disease of hypersalivation, mainly idiopathic or age-related hypersalivation. So this is the submandibular ganglia which secrete the saliva through this chorda tympani branch, ultimately coming from superior salivatory nucleus. This lacrimal part is coming from the upper part of superior salivatory nucleus, that is lacrimatory nucleus. Now talk about inferior salivatory nucleus. This inferior salivatory nucleus coming through ninth nerve through jugular fossa, and here in the floor, or you can say just below the jugular fossa, you can find one ganglia, that is Otic Ganglion in the foramen ovale. This is foramen ovale, and below this is the B3 nerve. B3 nerve having one ganglia, that is Otic Ganglion. Otic Ganglion in the floor of the base of skull, just below the foramen ovale. You having this. After passing through this jugular fossa floor and ultimately merging with the foramen ovale V3 branch. This V3 is coming from trigeminal nerve. So this trigeminal nerve having otic ganglia. This otic ganglia posteriorly giving one branch, that is auriculotemporal nerve, and this nerve supply the parotid gland. So these fiber of glossopharyngeal forming the tympanic plexus in the middle ear, that is lesser petrosal nerve. This lateral petrosal nerve coming and merging with this otic ganglia, lesser petrosal nerve, through which it's supplying the, this is the lesser petrosal nerve with the preganglionic. It means before the ganglia. It's having preganglionic fiber of this. That's why in, if you see Frey syndrome, you are cutting this lesser petrosal nerve, or you, that forming the tympanic plexus in the middle ear. If you cautery this part after elevating the tympanometer flap in the middle ear, you will definitely having the cure of the Frey syndrome. That is definitive treatment of the Frey syndrome. That is the complication of parotid surgery. So this infrasalivary nucleus going through this ninth nerve, lesser petrosal nerve, forming tympanic plexus, ultimately merging with this otic ganglia, coming out at 80 and supplying the parotid gland. So this is the third nucleus of parasympathetic ganglia, that is coming through inferior salivatory nucleus. Now this dorsal nucleus of vagus is also secreting nucleus which supply the various gland, cardiac smooth muscles in the thorax and abdomen. So this parasympathetic ganglia or parasympathetic pathway is very important for the ENT point of view, treating Frey syndrome, treating this lacrimetry or this nasal hypersecretion by cutting the posterior branch of the this parasympathetic supply, posterior nasal branch, which is branch of the median nerve. So these all are related with the parasympathetic column, or you can say parasympathetic ganglia. So these four ganglia are important for the ENT, guys. Thank you so much.